Hello everyone, welcome back to the second episode of Health Corner. I'm Dr. Ukpaka. Yes, the last time we spoke about fibroid, I tried to describe a few things around fibroid. How do you get fibroid? How do you prevent it? You know, the treatment we have available. What are the symptoms? In this segment, well, I would like to talk to you more about what to do if you suspect you have fibroids, and what are the things you speak to your doctor about, you know, that will help your doctor to direct you to the treatment you probably need. So, like I said, fibroid is a benign tumor when we're growing up from the womb, from the woman's womb, and it can affect different women. It does affect women of all races, but you know, in some women the symptoms are more problematic. And like I said, the symptoms of fibroid include heavy periods, heaviness in the waist, bloating. Some people might be going to urinate a lot, but you know, most women complain about heavy bleed and inability to get pregnant, especially the ones who are newly married and just discovered that they've got fibroids. Now, depending on the location of the fibroid, most fibroids do not give symptoms, but a tiny amount of them cause a lot of bleed. There are different locations of fibroid in the womb. There's the ones that are outside the womb that cause no symptoms. There's one inside the muzzle and the one inside the womb cavity itself. It is the one inside the womb cavity and some of them inside the muzzle lining that actually cause a lot of bleed. So it's very important when you go to your doctor, you know, to discuss your symptoms, that you know some of the things to ask your doctor. Not only about discussing about fibroids, but also to know the questions to ask your doctor. Now, if you're a young woman and you want to have a child, and the problem is fibroids, you know, there are treatment options meant for you. And some of those treatment options are available and, you know, at your doctor's disposal. But you have to tell your doctor that your main problem is to preserve the womb so that you'll be able to have children. Now, the treatment for that is, it could be myomectomy, which is going to remove the fibroid from outside the womb, or going internally, the hysteroscope, going internally to make sure that the architecture of the womb is not distorted. But know that there's also complications. Some of the treatments, especially the one I said, burning of the womb lining, a few of them, a few cases can be complicated by, can have complications like miscarriage. So just know that ablation or burning of the womb has a tiny risk of causing miscarriages. So, but your doctor or your gynecologist will be able to tell you exactly what treatment is best for you. Now, when you go to your doctor, ask your doctor, is there any tablets you can use if you don't want operation? There are tablets available, and there are tablets you can use to control the bleed, or which are non-hormonal. There are two of them. You know, you can use to control the bleed, or there are tablets that shrink the fibroid. But the ones that shrink the fibroid, unfortunately, will not allow you to get pregnant because they are used as contraception. Even though they are meant to shrink the fibroid, during the time you're taking it, you might not be able to conceive. The good news is that many people with fibroids can have children. In fact, many times when you do a cesarean section, you just see the fibroid on one side and then you remove the baby. So it doesn't mean that if you have fibroid, you can't have children. It's only when you've tried for up to 18 months to 2 years on the NHS, we can now say, oh, well, you have infertility, you know, you might need further investigations. And maybe one of the causes might be fibroid. So, you know, People can have fibroids and have a normal family life, can deliver normally. Remember, fibroid is different from one woman to the other, depending on the location. The ones in the lower part of the womb, called the cervix, might not allow the woman to have a normal delivery. For that woman will need a cesarean section each time she delivers. But that also depends on whether the woman wants this fibroid removed surgically first before having a baby or not. But the gynecologist will also advise you on the best way to go about it. Now, when you go to your doctor, be relaxed and also listen to the advice your doctor gives you. Remember, there are things you can do to help you control the growth of your fibroid, like losing weight. Stop smoking, alcohol. If you're diabetic or if you have blood pressure, make sure you take your medication and control these underlying medical problems. So if you're able to control your weight, that will also help your blood pressure. It will also reduce the risk of being diabetic. So weight control, preventing obesity, and living a healthy lifestyle is extremely important. So now, when you go to your doctor and you do not need children, then there are options. You can take the medication that shrinks the fibroid, or you can go for the different treatment methods which I described before. I said there's the non-surgical route where, depending on the size of the fibroid, if a fibroid is more than 3 centimeters inside the cavity, it tends to cause bleed. The ones that are less than 3 centimeters might not cause bleed, but everyone is different because you can have multiple fibroids. It's not just one. So if you go to your doctor and you don't want to have children, you might go for the operative option, where the doctor will go and just remove the fibroid, and then place you on some medications that will make sure that you don't have a lot of bleed. Now, that if fibroid is removed does not mean that it wouldn't come back, but we'll talk about that in the next segment. Thank you.
Health Corner on BENTV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Okay, welcome back. Yeah, we're talking about the different treatment options for fibroids. Yes. If you remember, I did mention that fibroid is more common among the Black and the ethnic minority groups. The Afro-Caribbean women, we have a higher incidence of fibroids than the Caucasians. So the treatments are the same, but you just have to know exactly what you want in order to get the right treatment from your doctor. One of the reasons why this program is on is to give people the information, empower you, so that when you go to meet your doctor, when your doctor is explaining the different treatment options, you'll be able to understand that. So giving you the right information about the treatment options is very important. So if you listen attentively, at the next treatment option, if you don't need children and you've completed your family, and you're having a lot of problems with fibroids, bleeding, heaviness, menstrual pain, you might consider to go for the next two different treatment options, which is, one is the non-surgical, where a trained radiologist under guidance of imaging tool goes to block the artery supplying the fibroid. The artery is the blood vessel that goes to supply that big mass in the womb. And once that is cut off, the fibroid will gradually shrink. So it's a very simple procedure for the people who are trained to do it. And it doesn't take time, and the woman is happy because it can be done as a day case, and you go home at the end of the day. So this is called uterine embolization, but don't worry about the big name. It's just about blocking the blood vessel supplying the fibroid. Now, the other treatment option, which is non-surgical, is ablation, burning off the lining of the womb. They can target exactly where the fibroid is and burn it off. But remember, if you don't want to have children, some people who want to have children might still get away with ablation, but the gynecologist will explain the risks. So I reserve the non-surgical, this non-surgical one for people who have completed their families. So it doesn't mean that if you want children, you can't have some of this treatment, depending on the gynecologist. Now, the other one is surgery. Surgery has two forms. Myomectomy is going to remove the fibroid from the abdomen. They could do it like keyhole, where they go in from outside and then just remove the fibroid, make sure they stop the bleeding from the hole. And that myomectomy is a good option for people who want to have children, because they just go target the fibroid and remove it. When they do that, when that is done, the person might have some tablets to sort of control the bleeding for some time. But the essence of that is to preserve the womb lining so that the uterine cavity is not distorted, because if it's distorted, it's going to make implantation a bit difficult. So this is myomectomy. Myomectomy has risk, more of infection or bleeding. This is why it has to be done by a trained hand. It has to be a gynecologist who is experienced in doing myomectomy. And if you have to go for myomectomy because you want babies or for any other reason, once it's done, you come home. If you have any problems at all, the doctors will explain this to you anyway, but if you have any problems like having a fever or bleeding a lot or having abdominal bloating, tummy bloating or tummy pain, please, you need to go into hospital straight. Don't stay taking medication and hoping it's going to go away, because what they do is that they're going to repeat. You have to have another scan to make sure that you're not bleeding internally. So this is why myomectomy is very important, that you know what to look out for if you've had myomectomy. The next one is removing the womb. If some people have up to 10 or 15 fibroids scattered around the womb, and you don't know which one to remove. If such a person has completed his or her family, or if that multiple fibroid is threatening the life of the woman, sometime the last resort will be to remove the whole womb. So sometimes you have to save the life of the woman by taking off the womb and cutting off any other fibroid growing as the best treatment option than giving medications that may or may not work. So, but the gynecologist will take that decision as a last resort. Removing the womb completely, like I said, will always be the last resort. Now, before that decision is taken, your circumstances will be taken into consideration. You have to sit down with the gynecologist and have a chat and make sure you are happy with that. So, but it's a treatment option, and once it's done, you never have fibroids again. So, in general, fibroids can be treated medically without operation. It can be treated non-surgical, which is going to block the artery or supplying the fibroid, or burning off the womb lining where the fibroid is, depending on the location. There's the surgical one, which is myomectomy, where it is removed externally so that the womb lining is preserved, or if there are so many fibroids in the womb, the whole womb is removed. But there are key facts about fibroids which I have to share with you. Fibroids do grow, but they can be there and cause no symptoms. Actually, majority of fibroids, do not cause symptoms. So please don't say because your friend has fibroids and had an operation, you have to go for treatment. If your fibroid is not causing you any symptoms, this is why this health program is important. Please do not bother yourself going for treatment, because people can live a normal life with fibroids and without any problems. Now, the other option, the other advice is, if you have fibroid and the fibroid is removed, there is no guarantee that it wouldn't come back, because as far as the woman is producing that hormone called estrogen, produced from the ovaries, the likelihood or the risk that the fibroid will come back is still there. So that the fibroid has been removed either through myomectomy, removing the fibroid externally, or hysteroscopy, removing it internally, to preserve the womb, does not mean it will not come back. But some women has been lucky, when a fibroid is removed and they get pregnant, the pregnancy tends to protect them from getting more fibroids. And as they are having more children, the less likely the fibroid, it is to come back. So fibroid can come back after it's been removed. Now, some people may take the medical option, especially the ones that shrink the fibroid, but the medical option might not work for them, for which they might have to go for the other option. But your doctor will always see you and monitor you and discuss this. Also note that when someone has a particular fibroid, it depends on the location. You can, like I said, you can have your normal children, with a fibroid, but that does not mean that having fibroid is a crime. It is very common. 8 out of 10 black women, or black and ethnic minority women, will develop fibroid by the time they are 50. So you can see how common this health condition is. So having a fibroid does not mean that you had an infection, you did anything wrong. It could be an innocent health problem that affects many women. So I'd like to thank BENTV for making this program a success. And this program will need sponsorship for the incoming series. So please, you are welcome to ask for more information. I know we might not cover everything you want to ask about or you want to know about in each program. So if you look at the contact details and the website, we have lots of information which might help you. But feel free to send us email or text, on the number you see, if you have any questions. Thank you.